So all this hinges, so this disease-modifying idea hinges on amyloid. We think amyloid drives the disease, although we're not sure. We think they're responsible for cognitive problems in people with dementia when we see them, because usually we see them, and usually when somebody doesn't have dementia, we don't see them, usually. But what we don't know is, are the amyloid plaques responsible for the disease? That's what we're assuming, and that's what we're going after in our trials. But it could be that amyloid's the byproduct of the disease. And so if we, let me show you it in another way. So if we have three strategies that we're working on focused on these amyloid plaques: blocking the production, the buildup of the plaques, removing them from the brain, or blocking their toxic effects. So if amyloid causes the disease and we remove them from the brain or block them from being produced in the first place, we might stop the disease or reverse it. We might. But that is making the big assumption that amyloid causes the disease. And we don't know that yet. So we're at a point right now where we're testing this idea in a number of different ways in people. So we've been doing it in mice. The industry's been doing it in mice for probably 15 to 20 years. Now we're doing it in people in clinical trials. One other area, so that the testing of these new drugs that remove amyloid from the brain or block its production is very exciting. It's a great, a great time in the history of fighting this disease over the last 100 years, where we're really on the verge of testing this hypothesis and possibly developing treatments that modify the disease. Another area that is very important is we now have the ability to see the amyloid in the brain when somebody's alive. So we don't have to wait till somebody dies and look at the brain under the microscope like Dr. Alzheimer did, like that last microscopic picture. That was a picture of brain tissue under the microscope after somebody died. We can now see amyloid in the brain using PET scanners, and a special medicine that we inject into people crosses into the brain. If amyloid's present, it sticks to the amyloid, and then we pick the signal up. Person on the right here, all that bright, we're looking at a cross-section of the brain, and you see red and yellow there's high density of amyloid in that person. That person has Alzheimer's disease. The person on the left, it's all blue, cool colors, because there's very little amyloid in the brain in that person. So the question is, can that be used as a screening tool? Well, that's a great question. So right now, this is pure research. We think in the next year or two, the FDA might approve this for use in the clinic. So that would change, really revolutionize how we evaluate people and diagnose people. We still have a lot to learn about what it means when people have amyloid in their brain. So we do know that, so we have actually here we have people who were scanned before they died on the left, and their brain tissue after they died was studied on the right. And you can see the dark spots on the right is amyloid. No amyloid in the top person, very, very low signal in the PET scanning on the left. Moderate amyloid in the second person on the right, higher signal there on the left. And lots and lots of amyloid in this person on the bottom is present in the brain, and you can see very high signal in the amyloid PET scan on the left. And so we now know, and this is 2011, so this is only a couple months old, and this is the first big study that came out showing this relationship. The burden of amyloid is reflected, so how much amyloid is in the brain is reflected by these PET scans. So that's really, really important. And so we're just on the verge of getting lots of good information on what it means to have amyloid in our brain for the long term. Now, we do know that most people with Alzheimer's disease have a lot of amyloid, but we also know that a lot of people without Alzheimer's disease have some amyloid. And when I say a lot, somewhere around 20 to 30% of people with no cognitive problems have amyloid in their brain. And that's the point of this slide. This is a little bit complicated, but the dotted line there is the proportion of people in the population who have Alzheimer's disease projected. We're using 3 studies here. So that's when Alzheimer's is diagnosed for a certain percentage of the population. When we look at measures of plaque and tangles, we see them begin accumulating in the 50s and rising well before the onset of the clinical symptoms of Alzheimer's disease. So what is this telling us? This is telling us that a good percentage of people, 20 to 30% of people with no evidence of memory problems or Alzheimer's disease, they have amyloid in their brain. And they potentially have the earliest changes of Alzheimer's disease that are, before we can recognize it in the clinic or before there's any cognitive problems or the dementia process begins. So we have a time window here, we think. We have a window of opportunity where we can identify the signs of Alzheimer's disease before any symptoms and potentially do something about it. So back to the question is, can we use this as a screening tool? And the answer is, that's our hope. Our hope is we can use these types of scans in people without any problems, maybe people at higher risk for Alzheimer's disease. We do the scan. If we see amyloid in their brain, let's do something about it. The problem is, right now, we don't have the tools to do something about it, proven tools. So that's what we're working on. So we're working on how do we recognize it before the symptoms, and then how do we do something about it.